Hi everyone. So today we are going to see about Margaret Helen Martin letter. So this is the letter. So first as we get a letter, we will be seeing writing tasks. Okay, first thing. So in this writing task, write a letter to the nurse in charge of the district nursing service, outlining Miss Martin's situation and anticipated needs for following her return home tomorrow. She is going to discharge tomorrow. Okay. Address the letter to nurse in charge, district nursing service, Greenwell Community Health Center, 88 Highton Road, Greenwell. This is the two address we are going to give. So after coming this, you are a ward nurse. So ward nurse means we will be writing it as registered nurse, RN, that is registered nurse. Okay. In the cardiac unit of Greenwell Public Hospital, your patient is Miss Martin due to discharge tomorrow. She is going to discharge tomorrow. Okay. Miss Margaret Helen Martin. This is the name. So we will be addressing her as Miss Martin. Okay. So she's 81 and date of birth had been given. So we will be preferring this date of birth instead of 81. Whenever they are giving both the things, we will be taking preference for date of birth. So address they have given, not needed. Admission date is important. So social family background. So family background is very important. This is an unknown case for writer. Okay. So never married, no children, lives in own house. This is very important. Financially independence is important, and lives in greater will. This is not important, no needed. Contact with family intermittent. So yeah, intermittent is important. So no longer drives. She is no longer getting drive, and she is taking Meals on Wheels, meal deliver service for elderly. So Monday to Friday, and order frozen meals for weekend. This is very important. So current diagnosis is she have coronary artery disease, angina. So she have undergone angioplasty for the second time. So first is 2008. This is the first history. So discharge date is 16. Okay, admission date is discharge. So discharge is they told tomorrow. This is tomorrow, so we will be starting it as today's status. This is today. Admission date we will be taking it as today. Okay, pending cardiologist report is pending. This is important. So she have past medical history is very important. This is unknown case, past history. So she has celiac disease, previous history of angioplasty. Okay, and anxious, that is common thing. Coronary artery disease, so she is taking aspirin, clopidogrel, etc., all these things. Okay, this is she is in current medications. All these things are very important. And coming on to the second thing, she have sedentary lifestyles. Okay, work, family history of coronary artery disease, and currently this is unnecessary. What we are going to focus is current diseases. Okay, so hearing loss and wearing hearing aids. Okay, that is important. So after the admission, they have a routine post-operative recovery. She have tolerating light and this is important. So bruising at the catheter site, no site of infection, bleeding noted post-operative. Okay, this is important. And current problem is anxious about returning. This is important. Okay, so current discharge plan is about diet. She have low calorie, high protein diet. Okay, gluten-free diet. So which is referred by her doctor, and frequent small, this is important, and physiotherapy light, this is important. We can include it in recommendation formula. This monitor wound site infection, this is important, and monitor adhere to medication regimen. Okay, this is discharge. This comes in recommendation paragraph. Okay, anticipated need of patient, home. So who need home visit from community health. Okay, we are writing this, monitor post-operative medications. Okay, this is important. It's okay. What they have recommended, dietitian, doctor and physiotherapy need to be continued, family support need to be encouraged. So this is the overall letter formula. So we will start to write the letter. So first thing is we will be starting with, yes, so this is a short page. So we will be writing this date. So we will be starting with 15 July 2017. Okay. The nurse in how they have given, nurse in charge. Either we have to write the in this area or the in this area. Okay, so already they have mentioned it as nurse in charge, so we have including the in this, nurse in charge. Okay, nurse in charge, district nursing service. Okay, no comma, anything, no punctuation, nothing you have to done. So Greenwell Community Healthcare Center, 88 Highton Road, Green. Okay, this is the first thing. So tier, nurse in charge, like this we have to write. Regarding full name you have to write Miss Margaret Helen Martin. So we are preferring date of birth 25 July 1935. Okay, then purpose para. I am writing this letter to refer Miss Margaret Helen Martin, who requires, so we are giving follow-up care after the discharge. So we will be writing as who requires follow-up care and close observation, because close observation or close monitoring, observation, because she's having some angioplasty, so we have to monitor that catheter site infection. So we want close observation from your service, because not at your service. At your service means we will be, so she's visiting the patient, so from your service if we are discharging to any nursing home means, so we will be telling it as at your service. So second thing is, she is recuperating after an angioplasty, which is actually the secondary to coronary artery disease. Okay, and angina. She will be discharged tomorrow. So in purpose paragraph, two things means what to do and why to do. So what we are going to do, follow up care and observation. Why to do is she's recuperating after a angioplasty, that is why to do. Okay, so second paragraph is current, elaborating the purpose paragraph. So current purpose paragraph is around Miss Miss Martin was admitted to our facility on 15 July 2017, or today you can write. Okay. Subsequently, what we have done, she underwent the procedure. Already we have mentioned the procedure, so no need to proceed that. Okay, so she underwent the procedure successfully.
Madam,
Okay. Okay. Then post-operatively, she has, so what she has anxiety about her health problems, mainly on returning to home. So in addition, she has bruising at the catheter side. Therefore, so we will be connecting this. Therefore, we will be connecting this to this recommendation to that paragraph. Okay. So therefore, comma, it is important to monitor her wound site for bruising or any infection. Okay, this is very important point. And currently she is on medication such as just aspirin and so aspirin and aspirin and clopidogrel for we have to write coronary artery disease, comma, metoprolol and meramipral for hypertension and atorvastatin for hypercholesterolemia. Previously she is taking, and but still she is recommended to continue. Okay, currently she is tolerating light diet and fluids as small frequent diets and snacks. Okay, so we have connected this. However, her body mass index is above the normal level, for which the low calorie, high protein and low cholesterol. So many things are there. You have to connect. However, we have to connect this all those things. Cholesterol, gluten free diet is recommended by the dietitian. So another more points are there. Consequently, a regular light weight exercise and walking would monitor by the physiotherapist. So this is the current medical formula. So next thing, this is the current medical history. So we will be writing the past medical history. Miss Martin also has celiac disease and had her first angioplasty in 2008. She has the family history of coronary heart disease. In addition, she is wearing hearing aids as she has the not she has she as she okay as she has hearing, not the hearing impairment. Okay, so this is the what is that family, previous medical history. So next one is social paragraph. Miss Martin lives alone in her house at Greenwell. This is first thing. She is financially independent and have contact with her family intermittently. Okay, she has Meals on Wheels on working days and orders frozen meals on weekend. So weekends. So this is a social paragraph. So finally, recommendation paragraph, that is discharge plan we will be reading. It would be appreciated if you could arrange home visit to monitor her complaints for post-operative medication regimen, exercise and diet pattern. Again we can continue. Which has been initiated by her doctor. So next one, kindly arrange for regular family visit to monitor her progress as she anticipates for the needs along with to avoid danger of family isolation and infrequent family support. Okay, this is the main important thing. Then other two importance, that low calorie diet, lightweight physical examination, we have connected with that main paragraph. Okay, so all the points we have been covered. So finally, so we have to put full stop. If you have any queries, please do not hesitate to contact me. Yours faithfully, because the name of the district social service in charge had not been given, so it's faithfully. So we are registered nurse. So punctuation, nothing we should not use. So finally, we have covered all these points. Yes. Coronary artery disease, contact, intermediate contact disease, celiac disease, angioplasty. So current medications. So hearing aids we have covered, bruising, anxious, calories, frequent meals, then physio, exercises, bruising, monitor medication regimens, connect all these things we have connected. Community district health, so that is the letter we have written. Regular monitoring of diet balance, family isolation also we have written. So all these points, this is the important points. Other than that, we can avoid all the things. All these points we have covered. Okay, if you have any doubts, please comment on my section. Thank you.